We've got this sort of big black cloud of vaccine passports hanging over us, which I find quite strange at a time when you see people, they're at the cricket, they're at big concerts, people are living their lives really quite normally at the moment, apart from people who still randomly insist on wearing masks in open air, which I still find utterly bizarre and strange. But do you think it's still realistic that the government will, beginning of October, start imposing a requirement for people to have proof of a jab when they've allowed the country to be open for a couple of months without that?
Well, this is what they are, the current line they're taking. And it's really important that we keep pushing back on that, that we don't let it become this inevitable slide into mandatory government policy. It's really critical that opposition parties are also, vocalizing the public opposition to this policy as well. But I mean, I totally agree. It becomes quite arbitrary. I mean, in fact, the whole system is quite arbitrary.
Yeah.
When we have, clubs open, we have pretty much life as normal now, or going back to normal, as close as normal as we can get at the moment. Many places aren't using COVID passes. And coronavirus deaths and hospitalizations are still staying low. We have a fantastic vaccine uptake. We've got really high level of antibodies. To kind of suddenly bring this in September, it does feel very arbitrary. And that's because really this policy is not about public health, it's about coercion. It's no coincidence that the emphasis has been around nightclubs and young people, because they're trying to get them to take the vaccine.
And yet we've seen the magnificent take-up. I mean, most countries would dream of the take-up that we've had from under 30s across their whole population. And we know that huge numbers of young people have antibodies, not from needing a vaccination, but because they've had COVID themselves and been luckily barely affected by it. And we know from all the data that's now emerging about all the different vaccinations, Pfizer and AstraZeneca being the main ones in this country, that actually immunity from having had COVID previously is much greater than having had the vaccine. Do you think that, I mean, again, I'm with you. I think a lot of this is political rather than it's about control and interfering in our lives rather than a health necessity. Because if vaccines work, you don't need vaccine passports because people are protected who already had the vaccine. And if vaccines don't work, then the vaccine passports are useless anyway. I'm double jabbed. Very sensible, I think, for someone in my age group to be double jabbed. Younger and younger people, less efficacious. Certainly under 30s, there is quite a lot of data suggesting actually they'd probably be better off getting COVID if they're healthy than being double jabbed in terms of their outline of risks. But in the situation where, as we discovered with the Delta variant, that actually you can still get infected with Delta variant and you can still pass on the Delta variant if you're double jabbed. There's not even a sort of a moral civil society argument for vaccine passports anymore, is there?
Well, no, I mean, yes, as you said, we know that if you have been vaccinated, you can still transmit and carry COVID. We know that lateral flow tests have a lot of problems with accuracies. The UK Healthcare Regulatory Agency has, expressed concerns about using them for COVID passes, and the American Healthcare Agency has said they should be thrown in the bin. So, the public health reasoning behind this is pretty slim. And in fact, we're concerned that, it could create a false sense of security around some venues. If you have this green tick pass, you're probably, maybe you've got a bit of a cough, but you think, well, I've got my green tick pass, I know I'm fine for COVID, I'll go ahead anyway, I've tested negative. And actually, you could be overriding the more kind of sensible measures, such as ventilation, maybe social distancing might be appropriate in some circumstances. But there are a whole host of, much more effective, proven public health interventions that can be, pursued and should be pursued over these kind of divisive, discriminatory, un-British COVID ID cards.
Well, you say un-British. I've just returned from France where vaccine passports were already in place. They came actually into place for bars and restaurants. We're told they won't happen here in the UK. I can't see any difference between a nightclub and a crowded bar, so I don't see any way to trust that won't happen if they do bring them in for nightclubs. But certainly, you're required to show a vaccine passport to get into a restaurant or a bar, even sitting outside. And there's a huge fine and even a year in prison for any venue license holder who does not check and verify that people have got these passports. And yet I've seen large scale, French people just not, they're going through the motions, but sort of think it's, from what I could see, think it's all rather pointless. The polls suggest that more than half of French people are opposed to them. We've seen massive big protests and demonstrations across the country against them. But does another country like France, one of our closest allies, does Macron bringing those passports in, do you think make it more likely it will happen here? Or do you think the reaction to it, the protests in France, might perhaps put the government off here?
Well, I certainly hope it will, because there's been hundreds of thousands of people gathering on the streets to protest against it, and I'm sure that if any government introduced this kind of thing here in the UK, there will be massive backlash, because we are not a papers carrying country. That's not how we do things here, and I think it will be deeply unpopular. Any government does not want that on their legacy. Certainly, they don't. And I hope that they will. Opposition parties as well will pay attention to that backlash, and I think it's really important as well to remember that this is not going to be a short-term policy. These kind of things have a habit of sticking around, and the same goes for the kind of public distrust that it will create, because we know that there will be people who will be put off of engaging with vaccinations if there are COVID passes, if there are mandatory coercive policies. But that can have long-term implications for public health in general. That could put people off of the next round of vaccinations, maybe getting their flu vaccinations, reduce trust in the NHS as a whole. It's so important when we look at these measures, we don't just look at the short-term immediate implications. We think about, how is this going to actually impact some of the most marginalised people and their trust for the government? It will certainly reduce it, and that can be very dangerous for years to come.
Absolutely agree with you on all of that. Madeleine Stone from Big Brother Watch, thank you very much indeed.